Drug Prep project is an EU-supported project that supports countries to implement foresight research for strategic policy making on a national level. EU drug markets are getting more and more volatile and complex. According to the EUDA drug strategy, drugs are everywhere, everything and everyone. How can policymakers in EU countries effectively respond to these developments and anticipate for future challenges? One of the tools that is currently recommended in modern policymaking is foresight research. Foresight research helps policymakers in getting more insight and understanding on possible future developments that could impact and shape the landscape of drug use, drug markets and profiles of people who use drugs. The EU-supported project Drug Prep is tailored to strengthen capacity among national drug information systems and policymakers to become more acquainted with foresight research in order to develop future-proof strategies.
It is a method that helps us to think about different possible outcomes for the future and how to prepare for them. The main asset of foresight research lies not only in thinking about and predicting the future, but also in actively collaborating with stakeholders to shape it. Foresight research is a participatory research design that utilizes mixed methods, including both qualitative and quantitative methods.
So, as a Finnish team, we began with horizon scanning to explore progress in society, technology, environment, economy, and policy. When we identified emerging trends, we set up an expert panel to validate our findings, and we agreed on 11 future trends that will impact Finland up to 2030. Later, another expert panel developed recommendations through scenario building exercises. Our findings are grouped into 3 categories: diversification of drug market, increasing demands and burdens on the healthcare, and changing social attitudes toward drug use.
I am Pavla Chominova from the Czech National Monitoring Center for Drugs and Addictions of the Office of the Government of the Czech Republic. We organized National Dialogue in February 2024 as a part of a regular meeting of the Committee of Department Representatives. This committee brings together about 20 stakeholders from different public administration bodies, institutions like ministries, police departments, regional institutions, as well as the non-governmental organizations. The dialogue we organized aimed to introduce the Drug Prep project, as well as discuss the horizon scanning trends, outcomes of the project work packages, basically those that were focused on drug field monitoring in Europe and foresight research in the drug policy. We also included proposed recommendations of the project. Within the recommendations, several points were approved in 3 main domains. The first of them was to strengthen drug information system, the second to strengthen threat assessment capacity, and the third to improve and implement response interventions. We believe that foresight methods should be incorporated into formal monitoring structures in future.
The Portuguese National Dialogue was an opportunity to establish a platform for dialogue and consultation, to carry out a perspective exercise and analyze the potential medium-term impact on illicit drugs of 6 previous identified megatrends. We had the participation of ministerial representatives of justice, housing, education, labor, social security and health, and an NGO of drug users. We reflected on potential future scenarios and considered the measures that should be implemented to mitigate any associated risks and advantage of opportunities. As a result of the Portuguese National Dialogue, several lines of action were agreed, of which I would like to highlight. It would be beneficial to consider ways to modernize and adapt existing responses to meet future demands as a result of emerging of new drugs, new consumption patterns, and new ways to serve specific group population, namely migrants and refugees. Historically, our planning has been based in information and monitoring systems that provide data from previous years and existing problems. We are more trained in reflecting on what is known and less on predicting scenarios and anticipating policies and measures. There was a recognition of the added value and usefulness of foresight studies in action planning and the need to continue these exercises, integrating them into policy planning routines.
Drug prep was a learning experience for all the researchers involved in the project. In general, a similar step-by-step plan was used. However, each country approached the exercise in different ways. So we can pull together some lessons learned and recommendations from the different national experiences. This brings us automatically to the first recommendation. The foresight methodology can be adapted to fit the project's objectives and capacity. Most crucial here is being transparent in order to justify the choices made.
And what we saw in drug prep is that participatory approaches are really crucial in foresight research, and it's important to involve stakeholders with wide expertise from early in horizon scanning. The drug phenomenon is a complex system that's characterized by many interlinked factors, so including that wide expertise allows us to explore it from different angles. Of course, carefully introducing participants to the foresight approach is key, because it's really important to create an atmosphere that encourages them to bring their own input and challenge what is put forward. Finally, it's important to see foresight as an iterative process, both within the research, so revisiting and validating your findings, but also repeated at intervals in the policy cycle.
All 6 partners were actively engaged in exploring the possibilities and limitations of various foresight methodologies. All partners have started with researching a variety of trends in our modern society and how these trends could impact elements of the drugs domain. For instance, how technological developments might shape future drug markets, or how mental health or societal trends like consumerism may influence the motives for drug use of adolescents. And what about the impact of climate change of the production and trafficking of drugs? One partner specifically focused on different scenarios of future developments, for instance in relation to the poppy ban in Afghanistan, in relation to new synthetic opioids. By approaching the drug phenomenon in this innovative way, the partners not only learned more about possible future developments, but also how to use foresight research as a tool for modern policymaking. We believe that national drug information systems and policymakers can benefit from the lessons learned of the drug project. And we recommend policymakers to use foresight research as a tool to anticipate and adapt to future challenges in the drugs domain with robust strategies.